Present lah.
Okay.
Sekalian.
So, JJ is a 6-year-old boy with underlying hearing loss. Presented with a history of 2 days of rash and also the difficulty in ambulating. So he on that day he came back from the medical event. The teacher told the mother that they noted the child was limping lah. But then the child before that in the morning the child was okay, still able to walk and all that. And then at night the child started having rash over the ankles. It was itchy and also painful lah. So prior to that the child did not have any urinary symptoms lah. And otherwise there was no fever, no abdominal pain. The BO was normal. However, the 2 weeks before that, he had one episode of loose stool.
Okay.
But after that, he was well. No hematuria, and no seizure or headache. Yeah. So on examination.
Okay, so we come with joint pain,
Yes.
right? So any differential diagnosis at this point?
Differential diagnosis. The first working diagnosis would be Henoch Purpura. Other differential will include Kawasaki disease.
So you said no fever?
Yeah, no fever.
Okay,
So
some more?
unlikely. Champion dengue, but no fever again.
Okay.
And,
Any trauma?
no history of fall or trauma.
Okay. Any bleeding issue?
No
Thrombo.
bleeding tendencies. No.
So if got bleeding issues like bruises and all that, that's what you have to think about.
We have to think about the
Juvenile what? No, if got bleeding disorders like bruises, indicate what? Thrombocytopenia. So you got joint pain. So what you must think about? What diagnosis?
lupus.
Not lupus can. Alright. So she is a girl. I wouldn't say that's wrong. But more common in children? Any blood disorders, blood problem,
leukemia.
Yes, leukemia. Okay. Alright. So in children also, if suddenly patient limping, you suspect joint pain, or I don't know, you suspect fractures or anything. So could be because of what? If you said there is no specific trauma.
Suspect abuse.
Yes, abuse. Pandai. Okay. Alright. Set next examination.
So on examination, child is alert. GCS is full. His weight is 21 kilos. He falls in the 25th to 50th percentile.
Okay.
His height is 140 cm, above the 90th percentile. He has good hydration from peripheries to pump his volume. Not kidney. Lungs is clear, equal entry. Her abdomen is soft, not tender. On examination of the lower limb, you can see the rash up to the mid shin.
Okay.
Naturally, and also swollen the foot.
So the rashes, is it macules or papules?
The rashes is papules.
Papules, why?
It's raised.
Raised. Okay. So the size?
The size is 0.5 to 1.
Okay. Alright. So symmetrical or not symmetrical?
Symmetrical.
Symmetrical. So that it involves lower limb.
Yes, only
Okay.
the lower limb.
The buttocks.
The buttocks was the second presentation.
Okay, alright. The hands,
Hands, no
trunks.
no lashes on the trunks.
Okay, alright.
So, and then so for investigations, we sent for a full blood count. HB was 11, NCV was 57, RBC count was 6. Platelet was slightly raised. Yeah, sorry, white cell was slightly raised, 15, and then the platelet was 610. Other than that, we also sent for urine dipstick. It was all negative. RP was normal as well. Urea was 3.5.
Okay.
Yeah.
So in the end, ultimately, your final diagnosis based on the examination and investigation.
Henoch, Schonlein, Purpura.
Okay. So what is Henoch, Schonlein, Purpura? I hope you baca already.
Yes.
This
is immune mediated. Usually, most of the cases is preceded by URTI.
Okay. So it's a vasculitis.
Yes, vasculitis.
Right, causing the immune mediated causing vasculitis. Okay. So, alright. So why there is joint pain? Why there is joint pain? Why patient got joint pain in a Henoch in HSP?
Because of the deposition of the IgA complexes.
Okay, alright. So, so the vasculitis can involve which part of the body, which organ, other than joint?
Can also involve kidneys.
Kidneys, okay.
And also the GI tract.
Okay. So if it involve the kidneys, how do you know?
There will be hematuria.
Okay.
And also look out for any facial edema.
Okay. Why you got facial edema?
Because of glomerulonephritis.
Proteinuria. Okay. Alright. So what you want to look for is patient have gut involvement.
So you want to watch out for any abdominal pain.
Okay, so what's the worst complication can happen if patient having gut involvement?
The worst is bowel perforation. I mean the
bowel perforation is because of something.
Yeah.
What is it?
Intussusception.
Yes, intussusception. Okay. So but commonly they have just severe abdominal pain lah. Okay, it could be part of the vasculitis symptoms, but you must rule out that intussusception. Okay, so how does intus present normally in children? What do they do?
They suddenly come with abdominal pain.
Okay,
and then in between the episodes of abdominal pain, they will be well.
Okay, alright. So when there is protrusion of the gut, so that one will cause pain. Then when it last settle on its own, then the pain goes away. So if there is protrusion going on, if you feel abdomen, what can you feel? Imagine two guts going inside each other, so it will be like something, it will be like a mess. So can you feel it or not? Yes, alright. So how do you confirm?
By ultrasound.
Ultrasound nampak apa?
Target sign.
Alright, okay. So if what is the late sign of intussusception?
Late sign.
So imagine you already have the gut protruding inside each other like that, and nothing can pass through. Can cause what?
Vomiting.
Yeah, obstruction lah. Okay, so obstruction present with? How do you see the sign?
Distension.
The distension, okay. So the late signs other than abdominal distension, what else? What's the typical stool like? Red currant jelly, okay. Alright, so how, if intussusception, What you must do?
To decompress.
So refer who?
Refer surgery.
Surgical. Okay, so decompression or surgeries lah. Okay, I wouldn't ask more into the details. So in HSP, what is the treatment? Any specific treatment for Henoch, Schonlein, Purpura?
Treatment is mainly to relieve the pain.
Supportive. Okay. So what pain medication we give usually?
We can give paracetamol.
Okay. Some more.
And also ibuprofen.
Okay. However, if the pain persistent, like severe joint pain, you already give that 2 medication you mentioned just now. The pain still there, persistent, very severe. Any other option we can give? Any other treatment we can give? Any other medication?
Prednisolone.
Yes, steroid. Okay, so steroid indication? Tahu?
Steroid indication if
other than
if
pain?
there is kidney involvement.
Okay, some more. What is more important other than joint pain? Abdominal? Severe abdominal pain also another indication lah. Okay, so if you talk about the kidney, I don't know. I wouldn't personally start prednisolone for proteinuria yet. I mostly just monitor. Sometimes that proteinuria is temporary. Okay, but they can go into nephrotic range later on lah. Okay, so if kidney involvement, I would probably get the nephro involved as well before starting prednisolone per se. Okay. So if we talk about joint pain just now, you said just now joint pain without fever can be leukemia, can be trauma, can be HSP. So any more? Can be JIA, yes, can be JIA also lah. JIA also not necessarily have fever lah. Only one specific type of JIA have fever, which is the systemic onset JIA lah. They come with fever, prolonged fever lah. Okay, 4 weeks, 6 weeks like that. Okay, if fever in JIA, the typical trend apa? Of fever. What they call it? Don't know. Every 4 days, every 3 days fever, coordination fever. Okay, alright. Then if during that fever you see the salmon patch rash, so fever with rash as well. Okay, so joint pain and rash, must be JIA, can be HSP also, must be because part of it is inflammation. So sometimes HSP may have some fever lah, but wouldn't be so high lah. Okay. But must think about your leukemia, must think about could be bone tumor also lah. Sometimes it's just because of the lytic lesion causing bone pain or joint pain. Okay. Alright, if patient like got URTI symptom, confirm influenza, then having joint pain. So what you call diagnosis of joint pain, if that is the scenario? If the example is positive influenza, then patient have joint pain. So what you call, so the diagnosis of joint pain is because of what? Dengue also. What you call it? That joint pain?
Myositis.
No, that's why the one is muscle joint pain. It's called reactive arthritis. It react to something lah, basically secondary to something lah. Most of the time dengue, influenza or any other virus lah. Okay, so if got fever and then joint pain, so your differential will be a lot different. So example other than JIA, can dengue, can sama. Any heart issue? The clue is probably heart problem or heart fever that can scarlet fever can have joint pain lah, but not very common. More of fever with rashes. Okay, some more. But scarlet fever can cause secondary issue to the heart. What is it called? What kind of fever is that? Fever with joint pain but with heart involvement. No. Acute? Start with R. Acute something fever. Your streptococcus, especially the group A, can affect the
Acute rheumatic fever.
yes, acute rheumatic fever. Okay, that's one thing lah. Then another thing, heart problem also. Maybe got VSD or something, then fever, then joint pain also. What? Any infection of the heart also can have this thing as well. Infection of that you call it what? Infective endocarditis lah. Some may have joint pain also. Okay. Alright, and of course sometimes it's the local infection at the joint itself lah. What you call it?
Septic arthritis.
Yeah, septic arthritis. Okay. Sometimes it can be osteomyelitis lah because it's near the joint area also lah. Okay. So that cover most of it lah. Most of the time fever with joint pain. Alright. Okay lah.